Sleep deprivation can push your blood pressure into a range that disqualifies you, even if your numbers are normally fine. That's not a scare tactic, that's physiology, and it shows up at DOT exams more often than most drivers realize. Here's what's actually happening inside your body when you walk into a DOT physical short on sleep. The exam checks blood pressure, heart rate, urine, and your overall alertness. All four of those can shift when you're running on fumes. Start with blood pressure. When you don't sleep, your nervous system stays in a low-grade stress state. That raises your blood pressure, sometimes just enough to bump you out of the qualifying range for that appointment. It's temporary, but it still delays your card. Heart rate follows the same pattern. A fatigued body works harder to keep you upright and functioning. Your resting heart rate climbs. Nothing is wrong with your heart. Your body is just compensating for the deficit. Urine results are next. Dehydration and poor sleep can shift your glucose and protein levels in ways that raise questions during the exam. Those questions take time to answer. Time you may not have if your medical certificate is expiring. Then there's cognitive clarity. Your examiner is watching how you carry yourself, how you respond, whether you seem alert. If you're foggy or slow, that gets noted. It's not about being sharp for a test. It's about demonstrating you can safely operate a commercial vehicle. Now, one rough night is one thing. Chronic sleep issues are a different conversation. If an examiner sees signs of untreated sleep apnea, things like extreme fatigue, high blood pressure that doesn't respond to treatment, or a physical presentation that raises concern, they may request additional testing, issue a shorter certification like 3 months instead of 2 years, or hold the card until follow-up is done. That's not a punishment. That's the FMCSA framework working as intended. Sleep apnea is a genuine road safety issue. So what can you actually do before your appointment? Go to bed early the night before. Cut off caffeine and alcohol well before you try to sleep. Keep your room dark and quiet. Put the phone down at least 30 minutes before you close your eyes. And drink water throughout the day, not just right before the exam. Hydration matters. If you had a rough night and your appointment is tomorrow, reschedule. At DOT Modesto, flexible scheduling, including evenings and weekends, exists for exactly that reason. There's no prize for coming in exhausted. Your one practical takeaway: treat the night before your DOT exam the same way you treat the night before a long haul. Rest is part of the preparation.